The Care Quality Commission is the regulator for health and social care. So we work with the government to set standards for the provision of health and social care, and then we make judgments about whether or not providers of care have met those standards. The other thing we do is we protect the rights of patients who are detained under the Mental Health Act. The annual performance of the NHS is a once-a-year statement about how well the NHS is performing. We rate the performance of the NHS according to two sets of standards. There's a set of quality standards that are looking at the core quality standards in Standards for Better Health and the targets, and you get a quality rating for that, which is either excellent, good, fair or weak. And we also rate the financial performance of the NHS, and that's on the basis of judgments made by the Audit Commission for Primary Care Trusts and NHS Trusts and Monitor for Foundation Trusts. This year, a slightly larger number of trusts have been rated as excellent or good than the previous years. In terms of the quality of acute and specialist trusts, so the hospitals, when we've been rating them, we've seen some fantastic improvements, particularly in the achievement of the 18-week referral to treatment target. We've seen big decline in the number of cases of MRSA, so healthcare-acquired infections are improving. One of the things that's happened this year is we've had a much harder look at some of those core standards. The trusts we're most concerned about are the trusts that have been weak for a number of years, or those that have never got beyond fair for either quality of care ratings or financial ratings. So we'll be working with the trusts and with the Department of Health and with the health authorities over the next few months to make sure that those trusts who still are weak against these important core standards improve their performance ready for registration. On the 1st of April, Standards for Better Health go, and they're replaced by a set of registration requirements. And what's happened is the government have consulted on a number of high-level statements about quality and safety in care, things like dignity, safeguarding vulnerable people, involving patients in their care, involving service users in complaints. We've spent the summer talking to patients and service users and carers about how we should be judging those standards. So it's not just a once-a-year assessment, it means 24/7, every day of the week, trusts have got to be sure that they're meeting these quality standards. Once we get beyond the 1st of April, if there remain problems, we'll be talking to the trusts, to their boards, to their commissioners. But if in the end the trusts make no improvement, we've got a number of legal sanctions that we can apply to the NHS for the first time. Patients can be assured that the trusts they visit are meeting these essential standards of quality and safety that we've been working on, and that if there is anything wrong with the services that they are experiencing, then the regulator has tough new powers to deal with it.